Okay, first of all, a very good morning to you. So, before we start with anything, I would like to know your name and where are you practicing in, and it's been how many years you're doing this?
Well, I'm Dr. Ashish Shah. I'm practicing urology for last 26 years now, and I run Ashra Urology Institute at Vadodara.
Okay, nice to meet you. So, we're gonna have the question hour session on OAB and kidney stone management. So, first question over to you. Let's start. So, what, according to you, is the best treatment for OAB?
Yeah. So the best treatment for AB is you restrict your fluid intake. That is one, and you modify your lifestyle according to your the urinary complaints that you have. If that doesn't work, the next step is you see urologist, and then you start the medicine whichever the doctor prescribes.
Okay. As you've spoken about modification, so what lifestyle modification would you recommend for kidney stone patient to prevent the recurrence of kidney stone?
That's an excellent question, madam. So basically, stone formers tend to have stones again even after they are out of the body. So there are a couple of things which need to be taken care of. One of them is that they should have a urine output equivalent to around 2.5 to 3 liters. So they should drink adequate fluids. The fluid should not be the water that they take should have less of salts. I mean, in the sense that it should be preferably boiled or it will be RO system. They should increase the amount of salt in their body, and the intake of proteins, animal proteins especially, should be restricted.
Okay.
That is how it is.
Like vegetarian.
Yeah, I mean, yeah, vegetarian, yes, but animal proteins do end up giving a lot of proteins which form a cast for stones to form. So if they are taking animal protein, then if intake should be restricted. That's how it is.
Heading towards OAB, so can you please describe for the audience viewing this, that's what is an overactive bladder and how does it impact the quality of life of a patient?
True. So what happens is ideally and normally, the bladder would have a sensation of passing urine every 2 to 2.5 hours, and then the person can go and pass. In an overactive bladder, the bladder's activity, as its name suggests, is very rapid, and so sometimes the person would pass urine every 15 minutes or 20 minutes, or would have an urge of urinate which he or she cannot control. So this is precisely what an overactive bladder is.
Okay. Heading towards the next one, what are the cons of delayed diagnosis? And also, can you please share with us with an example where the patient with overactive bladder delayed their visit to the doctor and what was the impact on their health?
True. So, yeah, unfortunately, there is not a lot of awareness on overactive bladder in our country. So, people tend to neglect it. People tend to take it as their fate, and this can be disastrous. We have had time and again, we have had instances where such overactive bladders are neglected, and ultimately, people end up in a lot of what we call as physiological damage, wherein the bladders get enlarged, the kidneys get damaged. Sometimes there's a lot of anguish to it, and the patient becomes mentally depressed and is socially outcast also. That's all.
Okay, last question over to you. So, what is your advice to an individual with overactive bladder trying to lead a normal life?
Right. So they have all the right to live a normal life. There's no doubt about it. All they need to do is go to a good urologist, talk to him or her about the problems, and now luckily there is a plethora of medicines available which can take care of the overactive irrespective of its severity.
Okay, so any message that you want to give to our viewing audience or upcoming urologist? Over to you.
Yeah. So the audience, yeah, all over my fellow citizens. So be active, be happy, and the body always gives you signals. So listen to your body and respect the body. Young urologists, well, welcome to the fold. It is a great branch, and the great future lies ahead for you.
Okay, that's all. Thank you very much for your time. It was really nice meeting you and have a great day ahead.
Thank you.